Myself Rajita, and today here I am again present with a interesting and new topic what we have discussing in the previous session regarding the fluid and electrolyte imbalance. So in the previous session we have already discussed regarding the essential management of a client who is having a fluid volume imbalance, or we can say a fluid volume excess or deficit. Now, in this session, we are going to learn about the conditions where different electrolytes will be going under imbalance, or we can say in a simple term, a particular individual will be showing certain clinical manifestations associated with the electrolyte imbalance. So, in this session, we are going to learn different electrolyte imbalance, its causes, clinical manifestations, as well as the management of the client with these conditions. So here we are going to discuss regarding the sodium imbalance, the potassium imbalance, calcium imbalance, magnesium imbalance, and phosphate imbalance. So first, let us start with the discussion of sodium imbalance. Now, when I say the term sodium imbalance, definitely it will be having two features. Either an individual will be present with an increased level of sodium in their body or in their blood or circulation. The second, where we are going to see the client will be present with a deficit amount of sodium in their body. Now, we are going to learn what can be the causes for these different types of imbalance, what are the clinical manifestations associated, as well as the basic or general concept of the management of the client with a sodium imbalance. So as we have learned, sodium is the main cation of extracellular fluid. So we can say predominantly the sodium will be present in the extracellular fluid as a cation. Now, this particular cation will be having a various important role in the maintenance of the homeostasis in the body. So, the primary role of the sodium is definitely in the generation and the transmission of the nerve impulses. So, in the body, this particular ion or sodium will definitely helps in the generation and transmission of the nerve impulses. Next activity of the sodium ion, we are going to see that it will be having a huge role in the maintenance of acid-base balance. Now, the acid-base balance we are going to discuss later in this session. So basically, this particular electrolyte have a very important and huge role in the acid-base balance maintenance for a particular individual. The next activity of this particular ion of sodium is maintaining the muscle contractility. So I hope you got the idea that it is a very essential element of the body to maintain the normal functioning ability of it. Now, here we have to learn that the sodium imbalance are typically almost always will be associated with the extracellular fluid volume deficit, or we can say there if there is imbalance in the extracellular fluid volume, often we are going to see the associated with that there will be presence of sodium imbalance as well. Now, from where we definitely get the sodium, or what can be the sources? Now, you need to understand basically sodium will be having a dietary sources. So whenever we are taking some dietary foods which are consisting of high amount of sodium, these are basically considered to be the source of sodium for a particular individual's body. Now, through the GI tract, the sodium will be getting absorbed into the body or into the circulation, and then it will be having or it will be performing its own activity in different cells within the body. Now, how the sodium leaves our body? It definitely leaves through urine, sweat. Even some amount of sodium can leave through the feces as well. So here we are going to see the absorption will be taking place from the gastrointestinal tract. The majority of the sodium ion will be leaving our body through the sweat as well as the urine. Even sometimes the person will be containing some amount of sodium in their feces as well in order to excrete the sodium out of the body. Now, the kidney will be regulating the extracellular fluid volume, or we can say the extracellular fluid concentration, by excreting or by retaining the water under the influence of antidiuretic hormone. So basically, the kidney have a very major role in the maintenance of the concentration of the sodium in the body. Aldosterone also plays a very important role here. Now, it is a particular hormone which will be definitely acting on the kidneys, and definitely we are going to see it will be regulating the sodium in the body by promoting the sodium reabsorption from the renal tubules. Now, that is how we are going to see the aldosterone and antidiuretic hormone will be maintaining the concentration of sodium and extracellular fluid in the body. So now we are going to read about the two different imbalance related to this particular electrolyte. So if there is a excess amount of sodium present into the extracellular fluid, rather than the normal level, we are going to term this condition as hypernatremia. So here, first we are going to discuss regarding the hypernatremia, what can be the causes of it, what are the clinical manifestations, and the general management of the patient with hypernatremia. So before that, you need to note it down. It is a very important point here that the normal value of sodium in an individual's body often vary from 135 to 145 milliequivalent per liter. So this is the normal value of the sodium in a particular individual's body. Now, if a client is present with a sodium level which is more than 145 milliequivalent per liter, we are going to term the condition as hypernatremia. So basically, it is suggesting or indicating the person is having high level of sodium. So what can be the causes of the development of hypernatremia? Let us discuss here. So the first causes which is very oftenly associated with hypernatremia is excessive sodium intake. Now, excessive sodium intake can be through the oral intake or dietary intake. Even it can be through IV administration of fluid. Basically, hypertonic sodium chloride solution, if it is used or without monitoring, if it is overused for a client, we are going to see hypertonic sodium chloride solution can cause the development of hypernatremia for a client. Excessive isotonic sodium chloride solution, if it is used as a IV administration fluid, then also we are going to see the client will be having a chances of the development of hypernatremia. The next is if a client is receiving a therapy where we are going to administer the intravenous sodium directly, that patient will be also having a high risk for the development of hypernatremia. Now, generally, the IV administration of sodium bicarbonate definitely will be causing a direct increase in the sodium level in the body. Hypertonic tube feeding, or the person or the client who are present in a clinical setup and receiving a nasogastric tube feeding, if we are using the hypertonic solution for the feeding, definitely a client will be having a high risk for the development of hypernatremia. Even near drowning in a salt water, the cases where we are going to see the client have a near drowning into the salt water, often they will be present with a condition of hypernatremia. Associated with these causes, these are very common causes which often will be associated with the development of this condition for individual is inadequate water intake. So as we have learned, the extracellular volume, fluid volume also will be maintaining the concentration of the sodium in the individual's body. So inadequate water intake can actually leads to the increased concentration of the sodium in the body, which will be considered as the condition of hypernatremia. Now, inadequate water intake is very commonly seen among the client with unconsciousness or a client if they're cognitively impaired. So those clients will be having a high risk for the development of this condition of hypernatremia. Excessive water loss, if it is present for a particular individual, we are going to see often the client will be having the development of hypernatremia. Now, excessive water loss can be occurred for an individual because of the presence of increase insensible water loss. In case of high fever, heat stroke, even a prolonged hyperventilation, we are going to see often the client will be present with increased insensible water loss from the body. Now, these are when the client is losing their extracellular fluid volume. Definitely, we are going to see there will be increased concentration of sodium into the extracellular compartment, and the client will be present with the condition of hypernatremia. The next cause is osmotic diuretic therapy. Now, osmotic diuresis therapy often will be provided to the client to reduce the fluid overload. Now, if it is not used in a proper regimen, or if it is not monitored the side effect of the diuresis, often we are going to see the client can develop with a hypernatremia. The second condition which is associated with the water loss and developing of the hypernatremia is diarrhea. So already we have learned in diarrhea a client will be losing excess amount of fluid from their body. Here also, as the water is or fluid volume is decreasing, we are going to see the client can develop with hypernatremia. Now, certain disease state will be directly causing the accumulation of the sodium or increased concentration of the sodium in the body. Now, this disease state include diabetes insipidus, primary hyperaldosteronism, Cushing syndrome, even uncontrolled diabetes mellitus often will be associated with the development of hypernatremia for our client. Now, as we have learned regarding the basic causes or the common causes which can be associated with the development of hypernatremia, now you also have to remember many other disease condition. If it is reducing the extracellular fluid volume or somehow increase the retention of the sodium, can cause hypernatremia development for our client. Now here, let us discuss regarding the clinical manifestations related to the hypernatremia next. So first we are going to learn regarding the clinical manifestations which will be associated with the hypernatremia with decreased extracellular volume. You need to understand the concept that here the person will be having a decreased extracellular fluid volume. On the other hand, here definitely the concentration of the sodium will be increasing, and that is the reason why a person is present with a condition of hypernatremia. So in this case, the common clinical manifestations are restlessness and agitation. It is very commonly seen among the client with decreased extracellular volume along with hypernatremia. Now, twitching of the muscles over the extremities are very commonly seen among the client with this condition. Seizure and coma, the often can be present or can be associated with the case of hypernatremia and decreased extracellular fluid volume. Often the client with this condition will be present with a sticky mucous membrane. They will be having excessive or intense thirst, as well as often the client will be showing the feature of a swollen tongue on examination. Postural hypotension, it is very common among the client with hypernatremia. And the next condition is increased central venous pressure. This will be often indicating that the person is present with increased concentration of sodium, and we can conclude the person is suffering from a hypernatremia. Increased pulse often will be visible or often will be seen among these clients. Weakness and lethargies and fatigue are very common signs and symptoms. Even the person will be having major weight loss associated with decreased extracellular fluid volume and hypernatremia. Now, the next condition where we are going to see the hypernatremia with a normal extracellular fluid volume. Basically, here what happens, the sodium level is going to get increased, but here in this condition, the extracellular fluid volume is not altering. So that is the reason why we are going to see a bit different feature among the client. So the features includes the same like the previous condition, basically the restlessness, twitching, seizure will be present. Even often a person can go for a comatose state. We're going to see there will be intense thirst mechanism will be activated for the client. Even the very common feature for this condition is the flushed skin. So often the client with a hypernatremia with no alteration in the extracellular fluid volume will be present with the flushed skin. Even the client can be present or can be showing the features of peripheral and pulmonary edema. Now here we are going to see definitely the client will be present with a excess weight or weight gain is a very common feature among the client with hypernatremia but with no alteration in the extracellular fluid volume. Increased central venous pressure often we will be seeing among this client. So I hope now you are completely aware about the causes and the probable manifestations for a client with hypernatremia. Next, we are going to read about the treatment modalities which will be often suggested with a client with hypernatremia. Now, IV administration or intravenous administration of 5% dextrose in case of acute hypernatremia is indicated often. 0.45% normal saline often will be used to treat the client with a chronic hypernatremia. So now here we are going to discuss regarding the nursing and the collaborative management of the patient with hypernatremia. So along with the electrolyte imbalance, here in this case, the client will be definitely having an imbalance or risk of imbalance in the fluid volume in their body. So definitely we are going to see an excessive intake of sodium or excessive loss of water often will be associated with this condition of hypernatremia. That is the reason nurse should identify this particular problem as a priority. So after that, the nurses will be planning the care depending on the identified problem for a client. The client also will be having a high risk of injury because you need to understand the client can go for a comatose state. Often we are going to see the client can have confusion, restlessness, agitation as well. Even we are going to see the client may have a seizure episode. That is the reason the chances of injury gets high for the client with hypernatremia. A nurse should be very vigilant to prevent any injury to occur for the client. The potential complication often includes the chances of brain damage here, as there is increased seizure or the patient is going for a comatose state. We are going to see the client may develop a brain damage. Here, that is the reason a nurse plays a very vital role to find out the hemodynamic status or the vital signs of the patient at the initial period. Even it is a nurse's role to find out any alteration into the sign and symptoms which is indicating that the client is present with a complication. So the managing the client at earliest with hypernatremia definitely will be reducing the chances of any complication development. So nursing implementation definitely includes a goal which basically suggests the nurse to treat and manage the client's underlying disease condition which is related to the development of hypernatremia. If there is a primary water deficit or fluid deficit, fluid replacement is provided either orally or through intravenous administration. Oral fluid intake will be encouraged by the client who are in a hemodynamically stable state or in a conscious state. IV administration often will be suggested for those clients who are having any contraindication for oral intake of the fluid. Now, as I have mentioned, often the client will be managed with a isotonic or a hypotonic solution. So generally 5% dextrose and 0.45% normal saline will be used for acute and chronic hypernatremia for the client. Now, if there is a acute excess amount of sodium present for a client with hypernatremia, we are going to see dilution of the serum concentration of the sodium is the main goal of the treatment. That is the reason often we are going to treat the client with a sodium free intravenous solution here in this patient. Even we are going to see often the client will be encouraged to be on a diuretic therapy or diuretic regimen to promote the excretion of the sodium through the urinary output. So often it is a nurse's role to monitor the serum sodium level for our client at a regular interval. Even monitoring of a hemodynamic status and vital signs for the client is a very important role of a nurse to find out any presence of sign and symptoms that is indicating that the client have a high risk of the development of complication. The next we are going to see the nurse here will be definitely identifying the response of the client towards the treatment regimen which has been prescribed. So whenever we are going to administer the intravenous fluid or we are asking them to orally consume the water in case of hypernatremia, it is a nurse's role to see whether the person is responding in a positive way and they are able to maintain their sodium balance within the normal level. Often, while doing the treatment of the serum sodium level, we are going to see there can be a rapid shift of the water back into the cells, which will be ultimately causing or can cause the development of cerebral edema, even neurological complication. So that is the reason it is a nurse's role to assess whether the person is present with any neurological symptoms which is indicating a complication development or a development of cerebral edema. Early diagnosis of the symptoms and a proper treatment procedure or initiation of a proper treatment definitely prevent the development of life-threatening scenario. Now, for those clients with hypernatremia, basically a chronic hypernatremia, dietary intake should be restricted with high sodium. So it is a nurse's role to educate the client and their caregiver regarding the disease condition, regarding the probable causes, as well as regarding the treatment procedure which has been prescribed. They will also plays a very important role to make sure that the patient is adhered to the medical regimen. They will be also responsible to look for the responsiveness of the client towards the treatment modalities which has been prescribed, as well as the client will be educated by a nurse related to their dietary intake, their rest and sleep, exercise, even a lifestyle modification. Now, as here we have learned regarding the condition of hypernatremia, next we are going to discuss regarding a condition which is termed as hyponatremia. Now, you need to make it clear, hyponatremia as the terminology is suggesting, basically it is indicating a condition where a person will be present with less amount of sodium in their body. Now, when the sodium level is lesser than 130 milliequivalent per liter for an individual's body, we are definitely going to see the client can present with a condition named as hyponatremia. Basically, we are going to see here the client will be having or developing the condition of hyponatremia, which is often result from a loss of sodium containing fluid from the body. Or if there is presence of any water excess or fluid volume excess, we are often going to see the concentration of the sodium is going to decrease for the client and the client will be present with hyponatremia. Now, what are the causes related to the development of hyponatremia? The first one is excessive sodium loss. Now, it can be gastrointestinal loss, which is definitely related to the condition like diarrhea, excessive vomiting, drainage from the fistula, even nasogastric tube suctioning. These are the main factors or main cases where we are going to see a person is more likely to lose adequate amount of sodium, which will be ultimately causing the development of hyponatremia for a client. Renal losses or renal conditions which is often related to the development of hyponatremia includes the usage of diuretics. Adrenal insufficiency also sometimes will be causing the development of hyponatremia. Sodium wasting, even certain renal disease like chronic kidney failure or certain disease which is affecting the absorption and reabsorption of sodium in the body, we are going to see it can be caused to develop a hyponatremia for a client. Now, through the skin also, sodium can be lost from a patient body, which is ultimately increasing the chances of the development of hyponatremia. So the example for the client or the conditions which is promoting the chances of the development of hyponatremia includes burns and a traumatic wound drainage. Now, the common causes also includes inadequate sodium intake through the diet. So, if a person is avoiding sodium-rich food, definitely they are having an increased chance for the development of hyponatremia. Excessive water gain, if it is occurring for a client through a excessive hypotonic IV or intravenous fluid administration, or because of primary polydipsia related to certain disease conditions, if it is increasing the fluid volume in a client's body, definitely we are going to see the client will be present with associated hyponatremia. So as we have learned here the basic and common causes, now we should learn regarding the clinical manifestations related to the hyponatremia. So first we are going to see the common features for the hyponatremia, where we are going to see the decreased amount of sodium is present. Now often the client will be present with irritability and apprehensions. Confusion and dizziness also is a very common feature for hyponatremia. Personality change are often seen among the client with this condition. Even the client can or may show the features of tremors, seizures. Now, client can go for a comatose state, often in case of hyponatremia. Now, dry mucous membrane, postural hypotensions, decreased central venous pressures are very common feature for a client with hyponatremia. Even we are going to see the client will be often present with the increased pulse, or the pulse will be very thready. The person will be almost always present with a cold and clammy extremities or skin. Decreased jugular venous feeling often will be associated with the development of hyponatremia. So a client with hyponatremia often will be managed by adjusting the dosage of the diuretics if it is already prescribed for the client. The next condition is minimizing the water intake. So if the hyponatremia is related to the excess fluid volume in the body, definitely we are going to suggest the client to minimize the water intake. Intravenous hypertonic saline solution, that is 3% sodium chloride, often will be administered or prescribed for a client to maintain their sodium balance in the body. Now, the nursing implementations, definitely the nurses have a very important role here. So the first role is to identify the problem that is present for individual. Depending on that, the nurses is going to formulate the nursing care plan in order to promote the healthy lifestyle for a client with hyponatremia. So definitely here a client will be present with a very high risk of acute confusion. Even the client, as they're having seizures, tremors, as well as the person can go for a comatose state, they will be having increased chances of injury. Now, the potential complication definitely involves the development of neurological changes and neurological complications. So that is the reason why here the nurses should be very vigilant enough to find out all the probable complication and related signs and symptoms at earliest to initiate a proper treatment procedure. So as a nurse, definitely we are going to manage the client with hyponatremia primarily with a fluid restrictions, which is often suggested with the client with this condition. Fluid restrictions definitely helps to reduce the fluid volume overload, which will be ultimately increasing the concentration of the sodium for a client with hyponatremia. Small amount of hypertonic solution often will be administered for a client with hyponatremia with a continuous monitoring. Treatment often includes here fluid replacement with sodium containing solution. So that is the reason often the person will be administered with a hypertonic solution. Now, definitely certain drugs can be used here depending on the client's condition. So, conivaptan and tolivaptan often will be used, which will be blocking the activity of antidiuretic hormone. Now, conivaptan often will be resulting in an increased urinary output without loss of electrolytes. So that is when we are going to see if a client is having excess fluid volume, we are going to see this drugs is very helpful to manage the client. But in this particular drug should not be used if the client is present with hyponatremia associated with excess water loss. Tolivaptan often will be used to treat the hyponatremia associated with heart failure, liver disease like liver cirrhosis, or the condition where we are going to see there is inappropriate secretion of antidiuretic hormone. Treatment with this drug often will be administered to the client in a clinical setup if it is indicated. Now, monitoring of the client's sodium level and the clinical status should be continuously done in a clinical setup. So definitely, I hope you are understanding nurses plays here a very important role to manage the client with hyponatremia. They should definitely be educated by the nurse regarding the disease condition, the probable causes, the sign symptoms, and the treatment procedure and the rationale behind the planned treatment procedure. Adherence to the treatment procedure and monitoring of the client and education related to the expected lifestyle modifications often will be very helpful to manage the client with hyponatremia. So I hope till this you are completely aware regarding the condition of hyponatremia and hypernatremia, the causes, clinical manifestations, as well as the basic treatment modalities and nursing role and responsibility to manage the client with this condition. So here we are going to end the topic of electrolyte imbalance, which is basically we have discussed only regarding the sodium imbalance. So in next session, we are going to discuss regarding another electrolyte imbalance, that is basically the potassium imbalance. So stay tuned for the next session.